All right, so thank you so much. Welcome to another episode of the Love Hope Lyme podcast. My name is Fred Diamond. Of course, I'm the author of Love Hope Lyme, what family members, partners, and friends who love a chronic Lyme survivor need to know. I need to say up front, even though I'm interviewing Dr. Darin Ingels, this show is not a replacement for medical treatment. If you're suffering from Lyme or anything related, please go seek proper medical care. Dr. Ingels, I'm not a doctor. I like to tell people I'm a history major with an MBA, but I wrote a book that tens of thousands of people have read, and I'm happy to provide this service to them. If you're listening to the Love, Hope, Lyme podcast on Apple, thank you so much. Go up, give us a 5-star review. We would greatly appreciate it. If you're watching this on YouTube, thanks again. We appreciate it. Go give us a thumbs up. Feel free to subscribe. If you have any comments or questions, please leave them in the comments field on YouTube. And Dr. Ingles, sometimes we get as many as like 30, 40 comments on the various shows that we do. We're well over 50 shows. We post the show every other Monday. And I'm very excited today. I'm talking with Dr. Darin Ingels. And, Dr. Ingels, I know that you've also are a Lyme survivor. So we're going to talk a little bit about that and the care that you provide. But a lot of people have reached out to me. I get people reaching out all the time asking for specific shows. Like, can you do a show on herbs? Can you do a show on pain? Can you do a show on just a whole plethora of ideas? But one topic that's come up a number of times is Lyme rage.
Yeah.
And I've had a couple people who've reached out and said, Fred, could you just devote an entire episode on that? So I've been tracking you and following you since I published my book in July of 2022. And I reached out to you, and you kindly agreed to be on the show. And this is a topic, among others, that we're going to address today. So once again, thanks. Introduce yourself and tell us a little bit about what you provide Lyme survivors.
Sure. Well, like you said, I'm a naturopathic doctor by training. I've been practicing for 26 years, and I lived about 30 minutes from Lyme, Connecticut for almost 20 years, which is where I got my tick bite. And I'm actually one of the few people I've ever seen in my career that actually had classic Lyme disease. I mean, I had the bullseye rash, the fever, the joint pain, the neuropathy. I mean, everything you read in a medical textbook, I experienced. And I got early treatment. I was treated probably within a handful of days of my tick bite. And within 4 or 5 days of being on doxycycline, I felt fine. But I got bit 2 weeks before I opened my own business. And when I opened my own business, I couldn't afford staff. So my ex-wife and I, who had a business at the time, we're kind of doing everything. So it was a, busy schedule, 6, 7 days a week, working long hours, trying to, keep everything afloat. And 8 months into that schedule, I started to relapse and
Mhm.
started having a lot of the same symptoms. So I figured, okay, if I treated it before, no problem, I'll treat it again. And I treated it with doxycycline for a month and I didn't get better. And then I switched to azithromycin for a month and I didn't get better. And then I started working with a local Lyme doctor that was very well respected. And then it was now the litany of oral antibiotics combinations. And, 8, 9 months into that schedule, I was just getting worse. So I was fortunate to have found a doctor in New York City named Dr. Zhang, and a lot of people in the Lyme world know him. He's a Chinese medical doctor and acupuncturist who developed his own line of Chinese herbal supplements. And he started me on one of his treatment regimens. And within a month, I felt 80, 85% better. So, it was a little bit of a wake up call that, A, I wasn't, taking very good care of myself, but B, there's a lot of power in herbs and plants and the ability to treat Lyme and these underlying infections. But again, it was a 3 year struggle to get to a point where I really kind of felt like I got my health back. So, of course, living in Connecticut, I'm now seeing a lot of Lyme patients, and I really just started applying what I was doing in my own treatment to these patients and found again that they would get better faster. And so, it was incorporating just really every aspect of Lyme care. And of course, coming from the background as a naturopathic doctor, we're always looking at, diet and nutrition and gut health and, things that other functional medicine practitioners talk about, that it's not solely focused on kill the bug. we have to look at the whole person and, what are the disposing factors that might have led to chronic Lyme in the first place? What are things in your environment that are affecting you? Are you sleeping well? Are you moving your body? So, I ended up writing a book, came out about 7 years ago, called The Lyme Solution, which kind of, is a 5-step plan that kind of walks people through everything I do with my patients today. So, here we are, 25 years later and 8,000 patients later.
Mm.
I've been able to, fortunately work with a lot of blind folks in dealing with this very, very multi-complex issue.
Absolutely. Well, thanks for sharing that. I'm just kind of curious, before we get deep into Lyme rage, you were living 20 miles from Lyme, Connecticut, like you said. Were you aware of Lyme disease before you got bit and before you saw the bullseye rash and realized that what you had? Was it commonly known as a medical practitioner or even just an average person living in that area?
Well, ironically, my very first Lyme patients when I was a resident living in Seattle,
Mm,
actually one of the doctors in the clinic had been camping in Wisconsin
mm,
and got Lyme disease. And so we were all kind of, helping him with his case. And, it's one of these things, you get maybe an hour in medical school on
mm.
and you know it exists, but, I hadn't really seen it. So that was my first patient that I ever saw with Lyme disease. Uh, and then, of course, once I got to Connecticut, I would see a few intermittent people when I
Mm,
first got there. The practice I was working at the time really focused on allergies, so
mm.
we weren't really seeing a lot of Lyme patients. And then, of course, what happens is once you get the illness yourself and people find out, it kind of becomes a draw. It's nice when you've got a doctor that's walked in your shoes and kind of understands what you've been through. But yeah, I mean, really prior to my own diagnosis, I hadn't seen or treated that many Lyme patients.
All right, Lyme rage. So, what exactly is Lyme rage, and how common is it amongst people who have chronic Lyme disease?
Well, in terms of how common it is, I don't know if I can give you exact percentage, but it's common enough.
Hmm,
And it's a multifactorial problem. And if you look at the way that Lyme, and when we say Lyme, I'm really going to sort of use that to say Lyme and co-infection,
right.
because co-infections can do this, and particularly Bartonella.
Yeah.
I think the between Borrelia and Bartonella, these two are probably most well known for having this ability to affect the brain in that
Hmm,
way. So we've got really, I think, three primary mechanisms going on. You've got direct interaction with the organism in the brain and the nervous system. We have research studies showing post-mortem, there's evidence of Borrelia, in and around the brain tissue. So, your immune system says, hey, you don't belong, it's trying to fight it. That creates inflammation. Second mechanism is we know that there can be an autoimmune reaction that Borrelia and Bartonella and these other organisms can cause. So now, in the ability to fight the infection, your immune system accidentally starts affecting the gray matter, the white matter of your brain, your peripheral nervous system. So now we've got antibodies attacking the nervous system, causing inflammation. And then the third mechanism is that there's some element of mast cell activation. Mast cells are the cells in the body that most people think of related to allergy because they release histamine and 200 other chemicals that can cause various issues. But we know that some people get a lot of mast cells around the brain, and mast cells can be triggered by allergen, pathogen, and toxin. So even the pathogen, like Lyme and Bartonella, can trigger that mast cell activation. Well, again, you start dumping histamine and all these chemicals around the brain, it's more inflammation. So, the end result of all these different pathways is inflammation in the brain. And really, depending on what part of the brain gets affected, you hear about brain fog, you hear about mood changes, you hear about personality disorders, you hear about Lyme rage, you hear about insomnia. So we see this whole, plethora of neuropsychiatric symptoms
Yeah.
that really often get unnoticed by a lot of practitioners. It's very easy to shuttle someone off to the psychiatrist and, hey, just go take a pill for that without understanding that what's driving the behavior, what's driving the rage is this persistent chronic inflammation of the brain triggered by these various organisms.
Wow. So specifically Lyme rage, what have your patients told you that they feel? You mentioned a whole bunch of neurological things, and we've talked about them on the Love Hope Lyme podcast in the past, and we'll continue to because that's such a huge part of this. But what are some of the symptoms that your patients might have said to you that lead them to believe that they're exhibiting Lyme rage?
Well, I think first and foremost, these are typically people who they're not angry people. if you go back in their history as children, younger people, they'll tell me it's like, I've been a happy-go-lucky person. And look, I can speak from my own personal experience. I don't know if we were talking just before we jumped on. I don't know that I necessarily experienced rage per se, but definitely I had a personality change. I felt very indifferent to life. And I do recall having like flat out 5-year-old meltdowns over nothing. And again, this wasn't my history at all. No history of mental illness and so when we start to hear that from people where I'm a different person and people around me are telling me I'm different, sometimes it might be hard to recognize in yourself, but when your partner, your family, your friends start speaking up and saying, hey, what's going on? Why are you getting so upset about this? Why are you getting angry about that? This is not your pattern. That's a big red flag. And when we start to hear about, these anger, the ability to flip that switch so quickly, particularly when, you've got this other collection of symptoms, particularly like joint pain and neuropathy, again, that's a big red flag that you've got this underlying infection that's driving that behavior.
So you mentioned indifference. Uh, we've talked about things in the past like depersonalization and things like that.
Yeah.
Uh, how does that talk to us a little bit about what that feels like when you're going through that so that other people can understand what that might look like if they're going through it?
Yeah, I mean, it's really, the indifference is truly not caring about anything. And again, it's something I experience. I've heard it from other patients where things that would normally spark joy in your life no longer bring joy. Things that you used to want to participate in, you avoid. You avoid going to group parties. You avoid going to dinner with friends. You don't want to be around people. Even for people who are generally social butterflies, they become very withdrawn. It's almost like the effort to have to be around people and just participate in life becomes so overwhelming. You just like, I just don't care. I don't care if I eat. I don't care if I wake up tomorrow. I don't care about my job. I don't care about my family. And again, you just know this is not part of somebody's nature. It's not part of your nature. And often this is something that happens over a very short period of time. It's more common that we see the shift happen. And I'll say I particularly see this in younger people. In younger people, we would call it PANS. We
Mm.
call it, pediatric acute onset neuropsychiatric syndrome. And it's really kind of the same mechanism. It's just that when you're older, we don't really call it PANS anymore because you're not a pediatric
Mm.
person, you're not a child. But ultimately, it's the same. Technically, we call it myalgic encephalitis, right? It's inflammation in the brain, and it's the same underlying mechanism. But again, it's so hard to explain in words to people who aren't experiencing this
Yeah.
what that feeling is. And often it's a feeling. It's dark, it's despair, it's overwhelmed. And if you could put it in words, and some people can, again, it's hard for the person on the other side, who's hearing this to really, I think, fully kind of understand and appreciate what the person's going through.
So on that topic, how can someone tell the difference between Lyme induced rage and regular anger, anxiety, or depression? I remember I was having a conversation with a Lyme literate medical practitioner who said, a lot of people deal with the challenge of the disease and not being able to treat it. Right. We all know about the complications in treating chronic Lyme disease.
Right.
Is that what causes the anxiety? Or does the anxiety come first? You had the anxiety and then it gets worse because of everything else.
Well, again, I think you have to look at a lot of factors. You have to look at genetics. You have to look at
Mm.
family history. You have to look at personal history. Again, do you have a history of anxiety? Do you have a history of depression? Do you have a history of these kind of things? Because there are some people who will say, yeah, you know what? I was always a very anxious child, but man, after I got Lyme, the anxiety went tenfold. So we can definitely see an exacerbation of a previous history that was there from your younger years after you get exposed to Lyme. But more often, I hear about people again who have no history of any of this. And it's not until they have Lyme disease that they start to experience these different neuropsychiatric symptoms. But again, typically we hear about all the other Lyme symptoms. So if you're trying to delineate, rage from Lyme versus just you're kind of a generally pissed off person, again, I'm expecting to hear about joint pain and neuropathy
Gotcha.
and insomnia and kind of the other, collection of 100 symptoms that Lyme disease has versus, someone who might just be that pissed off person that's not necessarily going to have those other symptoms.
I'm just kind of curious. So, uh, do you see the Lyme rage building? And if so, what are some of the effective strategies that survivors can use in the moment when they feel the rage building? Or is it something that just happens, right? Like without warning? You mentioned it briefly in the earlier part of the conversation. Again, does it kind of build and you can tell people, okay, when you feel it building,
Yeah.
do this, this, and this? Or is it like, boom, all of a sudden, the Lyme survivor snaps into something different?
Yeah, I mean, it can be a gradation. You have some people where it might build over time and then they finally pop, and other people it can just come out of nowhere and they blow up over. I mean, they could be perfectly, we'll say fine, and within an instant, some little thing just sets them off, and then it's a complete meltdown. For those who have that feeling like I'm gonna pop, yeah, I mean, if you can intervene, anything you can do to reduce inflammation is probably gonna help. And again, sometimes it's taking ibuprofen. Sometimes it's using things like curcumin or boswellia or harpagophytum. We have got a lot of plants out there that have really good anti-inflammatory effects. But anything we can do to reduce inflammation in the brain can help curtail that anger and that rage. For the people that don't kind of know that it's coming on. Now we're talking more about the chronic long-term strategies to prevent that from happening versus trying to nip it in the bud when it first starts. So again, for the people who are maybe fortunate to kind of know that it's coming, hopefully they can intervene sooner so it doesn't get to that point. But I mean, I can only speak from my own experience that that was usually not the case. It would usually be something that just happened, boom, and before I knew it, I was kind of losing my stuff.
So let's kind of follow up on that question for a little bit. So what would be some of your longer term approaches, treatments, therapies, supplements? Have you found patients heal from the neurological and emotional symptoms like rage or something rage? I mean, I remember I've spoken to people who said, I remember I spoke to one person who said she was angry for 5 years. She said, she was angry because she realized that her children were little and she couldn't get out of bed, right, to take her children to the park. And I remember she said, for 5 years, I was angry. And she said, I wasn't an angry person growing up. I was just, so,
Yeah.
what are some of the longer term approaches and can you heal from the Lyme rage?
Yeah, absolutely. I mean, ultimately, it's about getting the organism and the immune system under control. Because I think you have that initial stage of we'll call it acute Lyme disease, where again you got your immune system going after the organism, but it's almost like the longer it's there, your immune system gets a little lazy and says, "Well, you've been here a while, you must be part of me." And then that can start transitioning more into this autoimmune problem. So if we really start treating Lyme disease and these co-infections as autoimmune diseases and not just infections, again, we go far beyond just targeting the organism. So yeah, I mean, I will still use herbs to try and target the bug. And fortunately, we've got a lot of plants, and I know you've talked with Dr. Rawls and other people about various herbs to treat Lyme disease. So there's a strategy in controlling the load of the organism. But beyond that, now we have to clean up the mess of everything Lyme's done to your body and particularly to your immune system. So in my clinic, we do a lot with immunotherapy. We're now trying to turn off these different reactions because it's about load. And again, if you've already had Lyme, maybe you're experiencing hormonal issues, maybe other immune issues. So I hear this all the time from people that said, look, I've never been sensitive to anything in my life. After Lyme, food bothers me, chemicals bother me, mold bothers me. Okay, well, even if we're effective at controlling Lyme, we still have to go back and clean up this immune mess. So we will test and treat people for food allergies, mold allergy, pollen allergy, cat, dog, dust, chemicals, whatever it is in their world that seems to be an immune trigger. And the more we can keep taking that pressure off the immune system, down regulating that immune response, ultimately that controls inflammation in the brain. So we've got of course the diet and all the foundational gut stuff that we're doing to modulate the immune system. We're targeting the organism. We're using immune therapy to modulate the immune system. And we have all these other immune modulating things like low dose naltrexone. I'm a big fan of hyperbaric oxygen therapy, which I think is one of the best non pill ways to control inflammation in the brain for people who can have access and afford it. Uh, we've got other things like PEMF and things we can do to help modulate inflammation. So, depending on what you have access to, what you can afford, we try to implement as many strategies as possible to keep that inflammation under control and modulate the immune system. And ultimately, I mean, that's, I think, the path to success to get to a point where these things just don't set you off anymore. And it takes time. I mean, I wish I could say that, this is a month of treatment and then you're done. And the reality, it's months and sometimes years. And, for anyone who's been dealing with Lyme for a while, know it's often a roller coaster where you've got your good days and your bad days, and it can be very unpredictable. But, the expectation as we implement these different therapies is that if there is a regression, it's not as intense, it's shorter lived, it gets further and further apart, and then eventually we get to a point where hopefully we turn off the reaction. And I don't know if you've talked to anyone yet on the podcast about something called LDI, or low dose immunotherapy, but this is a very specific therapy that targets the autoimmune reaction from Lyme, from Bartonella, from Babesia. So knowing that these organisms all have that capacity to cause an autoimmune problem, this is basically dead organism that's been irradiated. It's diluted out almost really into homeopathic dilutions, and it's mixed with an enzyme called beta glucuronidase, which is something that's found in your white blood cells. And that seems to help, again, modulate the immune system to whatever you mix it with. And people squirt it under their tongue. It's only a couple of drops. But we found this to be one of the more effective ways to turn off that inflammatory reaction caused by these various organisms. So, that's been something we've been using for well, over 10 years as a way to, again, turn off that mechanism, I think, that drives a lot of that inflammation.
Wow. You've given us so much information today, Dr. Ingels. Thank you so much for sharing all this. Uh, I have time for one more question. A lot of people who listen to the Love Hope Lyme podcast, uh, most people, I originally wrote my book, Love Hope Lyme, for family members, partners, and friends to understand. And I thought that was going to be my audience of who was reading the book and who was listening to the podcast. In actuality, the audience for this is chronic Lyme survivors who are looking for ways to get more support or to get validation or to find some strategies to bring their family back and help them understand, what they're going through. So you've given us a lot of great ideas here. Before I ask you for just a final thought, what message would you share directly with the Lyme survivor who feels guilt, shame, despair over how Lyme rage has affected their relationships?
Yeah, it's really challenging, and I mean, I can just again share from my own experience. Again, I was married for almost 20 years, and it changed my personality, and ultimately, I think that was part of what led to the dissolution of that marriage. Obviously, there's a lot of other factors that go on, but I definitely changed. My personality changed, and I think it was very hard on the relationship. And again, I don't know that I could have put in words at the time what I was really feeling and experiencing. So again, I appreciate for people who are going through it. It's easy to feel guilty and bad about the way you feel, knowing that it's impacting your loved ones around you in a very profound way. And I think part of it's being able to step back and have a little grace for yourself that, this is often something that you are unable to control. Much like if I take a hammer and I whack your knee, it's going to jerk. It's a reflex action, and a lot of what happens with Lyme is just kind of a reflex action in the brain. It's nothing that you intentionally want to do. It's just something that kind of comes out. And so being able to, again, have a little grace for yourself and patience. And I think as much as you can educate your loved ones about what you're going through, hopefully they'll come to an understanding that hopefully this is a transient phase of your life, and that there are some hard moments and hard times for them to say, hey, look, I know this isn't you. This is something you're experiencing, and it's temporary, and we'll get through the back end of it. And just staying persistent with your treatment, because again, it's an up and down kind of path for most people. But I think as much as you can help educate your loved ones about what you're going through, hopefully they'll come to an understanding to know that this isn't really you. This is just something you're experiencing in the moment. And hopefully on the back end, you'll start to feel better, and we'll see less of that kind of behavior come out.
All right. Once again, I want to thank Dr. Ingels for being on the show. Again, if you're listening to this on Apple Podcasts, give us a 5-star review. If you're watching on YouTube, give us a thumbs up, give a comment, ask a question. Dr. Ingels, thanks again. And, thank you for all the amazing work that you've done for thousands of Lyme survivors. Uh, Anything you want to leave us with? Any final thoughts? Anything that you have that can, as people know, I was originally going to call the book Love, Loss, Lyme. And then I learned that people who have chronic Lyme have lost so much: relationships, livelihoods, families, whatever it might be. Give us a final thought, something that has kept you going.
Yeah, I mean, I think, this is Lyme is one of these things where you have to be your own best advocate. There's a lot of controversy in the conventional medical world around chronic Lyme disease. Sometimes people are gaslit. It's hard to get help. It disrupts so many aspects of your life. So, ultimately, I think, become your own best advocate. And, I say, Thomas Edison says you found 10,000 ways not to make a light bulb. And I see so much negative stuff on Facebook groups and out there in the media about chronic Lyme, and you can't get better. And it's very easy for people to fall in that mental trap of despair. And the reality is that it is built in our DNA to heal. There is a pathway to success. And you may have found things that don't work, but that doesn't mean there's something out there that won't. So just keep at it. And this is your one life. This is all you got. So don't give up.
All right. Life is for the living, as I like to say. All right. Once again, I want to thank Dr. Ingles for being on today's Love, Hope, Lyme podcast. My name is Fred Diamond.